Hi, Amy.
Hey Eric, how's it going?
Good.
Good. Sorry you didn't have to get the recording the way you'd hoped last week, but I don't know if you saw my message. I don't think it was your fault.
Oh, yeah, no, I did see that. So thank you for
Yeah.
saying that. Yeah, and I'm trying to remember on the hi Chris, how are you?
Good.
Welcome.
Thank you.
We'll just get set up, and I'm gonna make sure to give you privileges so that you can share. But I think it might be set up that way automatically. Um, yeah, so hopefully this week I've put it back to active participant mode, so hopefully it does record that way.
Yeah.
Hi, Christine.
Hi.
How is everyone doing?
Doing pretty good. It's about to be October, which I think is always the busiest month of the semester, but
Yeah, that's right.
yeah.
Right, things really start to heat up, Break
Yep.
begins, and
Exactly.
and for students, all the paper writing begins.
We don't have a fall break at UMBC, and every year I feel like I miss that.
Yeah, that's right.
Even though I've been at UMBC for, just under 15 years, I still miss the feeling of that fall break.
Yeah, makes a difference. Chris, are you guys on a semester-based system, or is yours a little bit different?
Ours is a little bit different because we teach back-to-back 8-week classes in the MPA program. So we have a week off in the middle of the semester every semester. So we have a week-long fall break and a week-long spring break.
That's right. Yeah, I remember when Aaron was there. I knew there was some sort of setup like that. It wasn't quite the typical semester, but it'd be really intense, right? For
Right.
a few weeks.
Yeah. So it's a semester's worth of credit in 8 weeks.
Oh, okay. Yeah. Yeah. I don't know which model is the best for either student learning or, on the faculty side.
Okay, Eric, it doesn't look like I have permission to share my screen.
Oh, okay. Let me.
Though it might be that I have to change a setting.
Okay. Let's see. So. Can you try now?
Let's see. I think I'm going to have to back out and come back in.
Oh, okay.
Has something to do with the screen recording. So I will be back in just a moment.
Okay. Yeah. No problem. Well, and while we're waiting for Chris, I want to thank all of you again for joining today. So this is now our third session on the speaker series. So again, thank you to Christine and Amy from the Center for Social Science Scholarship for helping to promote the event. Very glad to have you guys involved, and I'm glad to have the speaker today. So, again, sort of the vision for this series was really centered on the politics and policy of COVID-19. And, so as a result, sort of wanted to start off really focused on the politics. Last time we had State Senator Stephen Vita, discuss what it was like coming from the state legislative side in particular, and the role that state governments play in addressing COVID. Very glad to have Dr. Goodman here. He is an assistant professor of public administration at Northern Illinois University and is an expert on public finance, local government management, as well as intergovernmental relations. And it's, sort of in this latter role that we're particularly interested in some recent research he's done. And congratulations, I heard the piece is getting published, so that's wonderful. But looking at the role of state preemption, right? And we discussed last time and we questioned, what should be the respective role of different levels of government? Which are best positioned to grapple with COVID-19, and how should they interact, right? And we've certainly talked about the state and federal role, but what about the local role? And what role does the state government play, given that local governments are often considered creatures of the state? So, we're very excited to have Dr. Goodman here discuss some of his recent research and give us a sense about these respective roles. So let me see first, are you able to share your presentation?
I believe so.
All right.
There we go.
There we go. Thank you.
Okay, cool. Thank you. It's great to be here. So this is a mashup of essentially two different pieces, one of which is being published in a second. I'll show you the citation for that. The second is our work specifically on COVID-19. So all of my work on preemption is with Megan Hatch, who is at Cleveland State, and Bruce McDonald, who's at NC State. So bear that in mind as we go through this. So a little bit about me, as Eric already mentioned, I'm an assistant professor at NIU. My PhD and MPA are from the University of Georgia. I primarily come at this from a public finance side, but kind of the intergovernmental relations piece is becoming more and more important to my work. I don't typically teach about this stuff. I teach mostly financial management and stats. So this is a very different thing than what my students usually get to see from me. So just to kind of start us off here, let's see if I can move some things around so I'm not looking in 4 different directions at one time, is to think about what state preemption actually is, and then I'll back up and talk about how this is situated in the broader intergovernmental system. So this is our working definition of preemption. It's very different than the more limited legal definition of preemption, but it is the use of coercive methods to substitute state priorities for local policymaking. So this is our forthcoming piece on preemption. I'll go through kind of the broad swaths of this, but this will be out in Perspectives on Public Management and Governance next year, and a special issue on law and public administration. So to back up a little bit, states decide the nature of the delegated powers to local government in their state. This varies across states, but counties are constitutional entities typically. Municipalities are statutory entities. So states define the exact powers that either one of those have, and they're free to alter them basically at any time, given the confines of what the rules they've imposed on themselves through either state law or constitutional provisions. So the alteration of powers delegated to local governments is really completely in the hands of state governments. This has led to kind of 2 doctrines, which we argue and the literature argues aren't really 2 doctrines, are really a continuum, of Dillon's rule versus home rule. So under Dillon's rule kind of system, local governments are only allowed to exercise the powers explicitly granted to them by the state. So there's usually a menu of services available, of powers, and if a municipality wants to deviate from that, they would have to lobby the state legislature to alter their powers directly. Home rule is essentially the exact opposite of that. So if a municipality or a county has home rule, then they can exercise essentially any power not explicitly limited by the state, either constitutionally or statutorily. And in most states, like for instance in mine, in Illinois, we have a mixture. So home rule is available to cities and counties above a certain size and by local referendum, but otherwise defaults to Dillon's rule. And this is really common in most states, where we have some powers granted to some municipalities and some not. So we end up with this continuum of powers. And what preemption does is essentially move local governments from something more like home rule to more like Dillon's rule. We're starting to remove the authority to do various things under this system. So there's a bunch of different ways this can be achieved and a bunch of different characteristics of preemption. So on the method side, the standard method is typically legislative. The state legislature passes a law that limits the ability of local governments to do something, whatever that happens to be. What we're seeing under COVID-19, and I'll talk about more towards the end of this, is governors directly using essentially temporary preemption to limit the powers of local governments in interesting ways. But they're temporary and usually only accessible via the emergency powers afforded to governors. We can have judicial preemption as well. So this would be a more limited form of preemption, essentially clarifying what the state legislature meant in a particular legal proceeding. Judicial is interesting in that the process by which you arrive at a judicial preemption does not guarantee preemption. It essentially starts the process in which the judicial system could agree, typically with the state legislature, and say, we meant this, and that limits local governments in this way. Or a local government or all local governments in the state might enjoy expanded powers because of this, because of the interpretation of state law. And then the legislative is free to alter that in other ways. An interesting one, and it interfaces with what we talk about here in important ways, is preemption through ballot initiative, which is only available to something like 3/5 of the states. And essentially would be through popular referendum, limiting the powers of local governments. Oh, you can also limit the power of state governments this way. But a lot of tax and expenditure limitations I'll talk about in just a minute were achieved in this method. So separate from the method are the characteristics of preemption. So there are 4, they are not fully mutually exclusive. Generally, the first 3 are mutually exclusive, and the 4th is a characteristic that could be applied to any of these. So a floor preemption essentially sets a statewide policy floor. The state says local governments have to do whatever this thing is at some minimum level. You're free to exceed it in any way that you would like, but you can't go below that minimum. The ceiling is the exact opposite. So the state sets a policy ceiling. Local governments are not allowed to exceed whatever that ceiling happens to be. They are free to impose lesser restrictions or whatever that happens to be, but they're not free to exceed. Vacuum preemptions are a somewhat newer form in which the state essentially tells local governments they're not allowed to do something, whatever that happens to be. So they have an aspect almost like a ceiling where the ceiling is set at 0. But the state also does nothing in this policy area either. So the intent is to create a policy vacuum in which no either state or local actor is typically regulating in this area. And then finally, punitive is more of a characteristic of any of these, in which the violation of the preemption by a local government is met with punitive action on the part of the state. So, for instance, in Arizona, some of their more recent preemptions have been paired with preemptive or punitive provisions in which violating it or attempting to violate the preemption is met with restrictions on the local government itself, so losing state aid, for instance, but also might be paired with, it's the right way to put it, consequences for elected or appointed officials in that local government as well. So you might be able to be held personally liable, personally fined as a city manager or mayor, for instance, if you were to violate the preemption. So the punitive piece is relatively new. The other 3 are, as we argue, an escalating process over time. So through this kind of lens of what preemption actually is, which is a much broader view of preemption than, say, the legal definition of preemption, which is the legal process of removing home rule powers, we classify essentially 4 time periods of 4 epochs over which we can identify roughly similar preemptions being implemented and try to look at them through this lens of how were they done, what were their impacts on local governments, and what did local governments do as a response to this. So we roughly have them in decades. They're not fully mutually exclusive in these timeframes, so there is some overlap. But it helps us sort through how this process has been escalating over time. So in the first, or it's really not the first, but the first that we identify, tax and expenditure limitations, these directly limit the ability of local governments to grow, either through limiting their revenue raising powers or their expenditure powers. They're generally implemented legislatively, though there are important early examples that were instituted via ballot initiative. So Proposition 13 in California, or Proposition 2.5 in Massachusetts. And they vary in their restrictiveness on local governments. So they're just having a tax and expenditure limitation in a state typically doesn't mean anything in a generalizable sense. Their restrictiveness varies. So the more restrictive, the more pain imposed on local governments, the more hemmed in these are. And typically that pain comes through a combination of tax and expenditure limitations. So you might have your property tax raising powers limited in some way, but that also paired with a limitation on how quickly your expenditures could grow from year to year, for instance. A lot of the reactions on the part of local governments have been broadly classified as circumvention, figuring out ways to get around these specific limitations. The ability to do that is, in some ways, particularly the first point here about switching to unrestricted or less restricted revenue sources, is limited more so in the more restrictive tax and expenditure limitations. These tend to apply to all revenues or all expenditures. They're harder to circumvent in this manner. But there's good evidence to suggest that local governments have switched to largely or more so to unrestricted or less restricted revenue sources like user fees and things like that. Some of my research and others, but this is one of my primary areas, is about special districts, is circumventing tax and expenditure limitations by creating new local governments that are outside of the restrictive regime of tax and expenditure limitations. It is less common for TELs to be imposed on special districts. They're oftentimes imposed on cities and counties and school districts. In most states that have TELs, they're not applied to special districts. The very limited version of TELs that we have in Illinois is actually applied to special districts. That limits their ability to raise their property tax revenue from year to year. But that's relatively uncommon. So these were a particularly useful path to get around this and continue to provide services. Our next epoch was kind of the era of unfunded mandates. So this is an argument that we're trying to make here, in that they don't fit the exact definition of preemption, but have all of the qualities of them. So they are substituting the state legislature's policy priorities for a local government's policy priorities in mandating spending in particular policy areas. They're generally implemented legislatively in a floor type manner. All local governments must provide this service in this way. You're free to provide more than that, but you have to do this. There's shockingly not a lot of evidence about unfunded mandates on local governments. This is a pretty big gap in the literature. Understandably, the data here is pretty terrible. But in theory, spending should increase in the mandated area because the state says you have to do it. But the question becomes whether that spending decreases in other areas and the overall local budget stays the same, or whether we see an overall increase. So whether it supplements or complements the existing budget. So it's kind of unclear. But local governments largely responded by trying to lobby the state legislature to have these provisions removed, and explaining, that the impact on them was generally bad, or to try to implement cost-sharing provisions with the state and essentially turn an unfunded mandate into a funded mandate, where the state would then kick in some money to pay for this. The general feeling on this is that that local governments were largely ineffective in actually doing this, that they were unable to really have a lot of these removed, and we've just kind of started to live with them. That this is part of the local government landscape for this. The next area is public health related preemptions, largely around tobacco use is kind of the big one. But there are others in here as well, generally legislatively implemented, but ceiling preemptions. So you can regulate up to this level, but no more. So it limited the ability of local governments to implement stronger regulations, and there is some evidence that this had fairly negative impacts on local residents in terms of health outcomes. That local governments wanted to regulate smoking and things like that at a higher level in states that limited them, we saw poorer local outcomes. Typically, local governments sought to counteract these through kind of loopholes in the system. So, for instance, there are a couple of states that implemented preemptions around particularly tobacco use, but grandfathered in existing policies and left a policy window in which local governments could quickly enact a higher than the preemption level of regulation that would then be okay because it was in existence on the date of enactment of the preemption. The kind of an interesting piece here that we haven't fully explored yet is there was a lot of policy learning here, and that local governments kind of tried to lead on this. Many states limited them, and then eventually the states came around to the local government's position and said, these are areas in which we probably do want to regulate at a higher level. We saw some kind of vertical policy learning here. There's some great pieces on this in the literature. The last bit, and this is particularly relevant to the COVID-19 stuff, is what is called in the legal literature the new preemption. So there isn't a common policy area. There isn't a common means of achieving these preemptions. But the common theme is they tend to be punitive or vacuum or both in nature. So there are states attempting to non-regulate something either at the state or the local level. And local governments are typically kind of hemmed in with these because of the restrictiveness and the punitiveness of these mandates. There's significant cost to defying these kinds of preemptions. We haven't fully cataloged the reactions to these. There are some common themes kind of going through. So trying to organize and provide some kind of public relations campaign. The National League of Cities is really leading on this. There are some instances of open defiance and essentially daring the state to impose these punitive measures. And then some limited amount of circumvention of trying to figure out ways to get around these new preemptive laws. So for us, as kind of three public administration and public policy scholars, trying to figure out what all this means for managers, for the literature, really this historical approach is a continued pattern of escalation between state and local governments, where the state is really imposing its will on local governments kind of nationally. The preemptions have become broader and more restrictive over time. And for us, the question is, on the literature side, are preemptions normatively good? Is this a system that we would be okay with kind of perpetuating? And the answer is really unclear, really depends on the policy area. We have no clear guidance here whatsoever. We postulate for some areas. So for instance, in housing, for instance, this might be okay, in which we have pretty good evidence that local governments are not allowing enough housing, new housing to be generated in areas, leading to pretty large price increases and all kinds of exclusionary results. So a state stepping in and saying, sorry, local governments, you have to allow for more housing generation across all of these local governments might be normatively good. But in other areas, we might suggest that it could be normatively bad. We need a lot more work on this to think about that. For managers, it's a little bit of a different story in that if we think that increasingly broad preemption reduces the local variation in kind of service delivery, we're increasingly mandating exactly what local governments have to do. That may or may not be bad, depending on your perspective. we're achieving more uniform service delivery across all local governments in the state. But that then begs the question, why have local governments if that's what the policy wants to achieve? Is this uniform service delivery? We essentially then just have local implementers of state policy, and that's probably not what people actually want. Similarly, there's this urban-rural divide on these typically, where we have typically definitely more rurally represented state legislatures imposing restrictions that are mostly falling on urban governments. And there's some evidence to suggest that there are kind of economic costs to these, particularly around very unpopular preemptions, usually in social policy. So, for instance, the HB2 in North Carolina, the bathroom bill, led to a lot of private businesses saying we don't want to do business in North Carolina anymore, leading to some fairly significant economic costs to the state because of that. So on the manager side, the implementers of local policy, what does this mean? And we've been thinking about this process of this ultimately leads to city managers having multiple principles and kind of a principal agent framework, that they have multiple folks that they need to listen to, and it's unclear how they should prioritize them. Once we've always had the residents and local officials, and in theory, local residents should trickle through local elected officials, but maybe imperfectly. But now we're adding state officials to that as well, and trying to figure out, well, who should we listen to when the state says we can't do something? Local elected officials and residents are saying we need to do this thing that's limited. How do we actually find some middle ground and implement something that satisfies all of the principles? That's a huge undertaking for a city manager to actually try to implement. And kind of on the more normative side for this is that managers almost never get to implement the best policy. There are reasons why that may or may not be able to happen. And the question becomes then, does preemption lead that to something not even second best, but third or fourth best? And we're just implementing bad public policy at this point. We can make some argument that, second best policy is okay. It's obviously not ideal, but achieves its goals maybe in a slightly inefficient way. If we're moving to third or fourth best, we're maybe not even achieving our goals, but implementing something more kind of ceremonially at that point. So there's a lot of questions here. And that leads me to kind of the COVID-19 context to this. So typically, kind of emergency management has been a bottom-up process. Post 9/11 has kind of changed that a little bit, but still is typically bottom-up. In that local governments do a lot of the heavy lifting. The state provides a lot of support to local governments in terms of all kinds of things. And to the extent that emergencies cross state borders, we have the federal government to coordinate some of that activity. This assumes highly localized disasters, natural disasters and things like that, in which we have a defined area over which something is occurring that is relatively small in the kind of the grand scheme of things. The issue with COVID-19 is that this is not a localized disaster. This is a worldwide pandemic that doesn't respect any kind of borders. We don't have a contained emergency process here. We have this highly uncontained, highly variable process. And what this ends up suggesting is that any individual local action on the part of a municipality or county, for instance, may be completely offset if their neighboring city or county chooses to not do something that then leads to an increase in case count or what have you, that then spills over into the more restricted local area. And this suggests a larger role for the state, or potentially, or ideally, the federal government, to step in and set some kind of minimum policy standard that says, this is going to be our public health process for this. You are free to be much more restrictive if you like, but this is the minimum level of kind of public health service provision that's going to exist during the pandemic. So in this is a separate paper that's currently under review. we tried to look at, how local governments implement policy. So this is from the National League of Cities COVID tracker data, looking at when they're set up local governments. This covers like the 100 largest cities and like 75% of the largest 250 cities in the United States, the timing over which they implemented policy around COVID-19. This could be a whole wide variety of things. And this graph here shows that local governments were pretty quick in doing this. Most of us in universities would have really kind of, this makes a lot of sense in that most of us kind of shut down in this time where we have the big spike here around the middle of March. So this became really obvious. Local governments acted and continue to enact policy over time. Our cutoff is the end of May for this particular data collection, but we continue to see policy implementation. I'll explain this a little bit more so in just a bit, but this graphs the data by state. The vertical dotted line is when the states closed public schools, and the solid vertical line is when a state implemented a stay-at-home order. So mapped against time, the boxes represent preemptions. So the dotted boxes are floor preemptions associated with the stay-at-home order, and the solid boxes are ceiling preemptions associated with the stay-at-home order. So some states never issued a formal stay-at-home order. So like Nebraska, for instance, didn't, but most states did. And a number of states implemented a floor preemption saying this is the minimum level, essentially, of how the stay-at-home order is going to work. You are free to alter or be more restrictive to implement a higher level of kind of stay-at-home order locally if you'd like, but this is the statewide minimum. And then in other areas, there were generally limitations on what local governments could define as, say, an essential business. That was a very common ceiling preemption, in that the state defined that for everyone. And that I'm thinking of Georgia in particular. Georgia's a large offender here in our data for various kinds of preemptions. They have multiples in multiple contexts of strictly defining exactly what an essential business was, and telling local governments you are not allowed to restrict these businesses in any way operating under our shelter-in-place order, which their definition was particularly broad, allowed a lot of businesses to continue to operate, and local governments weren't allowed to kind of tailor their response to say, we don't want some of those to be open during this process. So on the right here, we have 10 states with floor preemptions, 10 states with ceiling preemptions, and 30 states with none. These are just in the shelter-in-place orders. They're far more associated with other kinds of preemption or other kinds of orders. This is part of our research into this, is that there's essentially a continual process of issuing executive orders around COVID-19 that in slight ways change the way that local governments operate. But these preemptions, these executive order preemptions, are generally rare because they're only typically accessible by the emergency powers afforded to governors. So basically, there's an emergency declaration that slightly changes the kinds of things that can be done directly by governors without the need to involve the state legislature. But these are generally temporary. So a lot of these preemptions went away when the stay-at-home orders expired. But they can be extended or limited by the state legislature. So, for instance, in Wisconsin, the legislature essentially overrid the governor on his executive order about the stay-at-home order that very quickly ended the stay-at-home process and quickly opened up the state on a very limited time frame. These also were challenged in court. We're seeing that more and more often, that have implications for whether these preemptions continue or don't continue. So it's a kind of a continual process here with these, but they are generally temporary. And the big question is, what was the effect of these on local governments? And the answer here is kind of unclear. ceiling preemptions generally were bad in that they limited these kind of more highly localized responses in which some local areas saw significant spikes in case count and hospitalizations and things like that would have warranted potentially a higher or more restrictive lockdown. But those were generally not allowed under this kind of preemption. This extends to all kinds of things. Some of the more recent examples are around local mask orders and under which those could be implemented. Georgia initially preempted its local governments from having local mask orders at all. It eventually backed off of this and allowed local governments to go ahead and do this. But that was not before kind of a legal process started between the city of Atlanta and the state of Georgia over this preemption. But it does appear that the floor preemptions help to deal with this kind of non-localized process that COVID-19 is existing under. This kind of different than our emergency management system is built for process that set a policy minimum around these things, and areas were free to tailor that to be more restrictive, but this was the way it was going to go in the state. I can tell from personal experience in Illinois, we have a floor preemption around a bunch of different things. Initially, COVID-19 really hit the Chicagoland area hard. It hit most northern kind of major metropolitan areas much harder than in the South. And the southern part of the state, which is far more rural, was very resentful of this process, in which many counties saw no cases or for an extended period of time, and actively fought to be exempt from this floor preemption that applied to all local governments in the state. And that opinion has stayed even as these more rural areas have been hit harder on a per capita basis more recently than previously. So floor preemptions are not popular, particularly in diverse states, at least in our kind of anecdotal evidence. So thinking about this process kind of overall, it's a little unclear what this means because of the temporary nature of the executive orders. That most legislatively imposed preemptions are permanent, conditional on the legislature not reversing itself. These are not. These are far more temporary. So what lasting effect there is probably limited. But it is a clear continuation of the trend towards using more preemptive powers against local governments and limiting their authority, even temporarily. That we just see this as a continual process of states wanting to impose their policy priorities on local governments throughout and in many, many areas, which is a fairly stark departure from kind of the home rule era of the kind of teens to 50s or so, in which states that granted home rule powers, at least, were relatively hands-off for local governments, at least compared to the current period, which is much more kind of active on the part of local governments or on the part of state governments. And the issue here, and we try to get this into our forthcoming paper, is there's evidence that previously state legislatures took this process really seriously. That that local associated state legislation was very common and was used kind of in an orderly manner by state legislatures. And there's some evidence, though we haven't really dove into this yet, that state legislatures are not taking this process as seriously, in that there's less kind of deliberative process of why we would do this, and it's more reflexive in this process. So we haven't gotten completely into that yet, but certainly we have the general kind of idea that that's what's going on, is that state legislatures are taking this less seriously and imposing these a little more haphazardly than they did before. So I welcome your questions. I'm happy to chat more about this. Thank you very much.
Great. Well, thank you very much, Dr. Goodman. And I'll absolutely open it up to questions. As I generally do, I'll kind of lead off with one of them, but then feel free, others, to unmute yourself and ask questions, or at least type into the chat box. You know, this is really fascinating, and I appreciate sort of the broad overview you gave in terms of how we think about preemption, right? You know, it's not a unified thing, and you see these distinct periods. I appreciate also the kind of refinement when we think about state preemptions as being sort of a floor or a ceiling. And I think that's really useful in this context, right? So when I think about the motivations for state governments to set the floor here, right? Very obviously for me, there's probably some consideration around public health, right? As you noted, viruses don't know traditional boundaries, right? They're not refined by legal jurisdictional boundaries that exist. So that motivation makes sense. I'm wondering if you have any thoughts or anything you're seeing in the data in terms of the motivation for setting the ceiling. When a lot of these local governments have more restrictive policies, is it, you know, is it the business interest groups that are lobbying the state not to do it? Is it electoral incentives? Are they just watching, you know, what's happening at the federal government and listening to President Trump? You know, do you have a sense of like why they're intervening to, you know, kind of hinder maybe more social distancing measures that are more stringent at the local level?
Yeah, that's a good question, and it is certainly a part of kind of the puzzle that we're trying to unpack. Is, you know, why would state legislatures primarily in our research do these things, and particularly in a kind of ceiling manner? There's some evidence to suggest that these are driven by ideology. So is this kind of more conservative state legislatures imposing, you know, policy ceilings on typically more liberal cities? There's certainly a kind of business regulation aspect of, you know, from a business that operates in multiple locations across the state, they would much more prefer to have a uniform regulatory regime, local regulatory regime to deal with. That's cheaper to deal with. And it's a lot easier to lobby a state government to impose that on your behalf rather than lobbying however many municipalities that you operate in to adopt something close to similar regulations. There's some evidence in my own empirical research, I've not found evidence of this, but there are certainly published pieces that have looked at professionalization in state legislatures. So whether state legislators have the time and the skills and the staff associated to adequately prepare legislation in a serious way, and for those that are less professionalized, potentially more susceptible to adopting model legislation and things like that is more developed from the business community. That, you know, we might see some diffusion of similar policies across states that are associated with model legislation. So that's a kind of a piece to figure out, is on the ceiling and vacuum side, why do this? What are the incentives? We haven't kind of gotten to a great answer yet.
Yeah, great. Well, thank you. I definitely want to open it to others, but just a quick sort of follow-up question to that. On the ceiling side, were those mostly social restriction ceilings, or were they more about what businesses could operate? Did you see that?
It was a little of everything. Okay. But typically it was defining what an essential business was and could continue to operate. That was the kind of the most general approach to the ceiling preemptions for this. There are obviously other areas, like the mask orders ones are ones we haven't fully cataloged yet, but certainly that was an issue in Georgia of, you know, the state saying we're not going to allow anyone to do this, and the local government's saying, hey, this seems to be fairly essential. You know, why not? And that was maybe the most visual and public battle over that. And that, you know, the large cities in the state decided to take a very defiant approach and saying, we think the scientific evidence, and now the consensus scientific evidence is, local mask orders are good. We should implement them. They will certainly have an impact on public health. And, we cities think you state are 100% wrong on this, and being very vocal about it.
Great. Well, thank you. Good. Let me open it up. What questions do we have?
Hi, Dr. Goodman. Quinn Murphy. I had a question. You used a term to describe when managers were faced kind of with different orders at different levels. What term was that? Could you say a little bit more about that?
So for that, we're drawing from principal agent theory about, how do managers who are essentially the agent of other folks, and depending on how you want to define it, typically elected officials. So they're essentially implementing policy that is given to them. And how do they actually go through that process? It becomes more complicated when you have multiple principals under that regime. So whose voice is the most important? Is it the one that directly employs you, the elected official or a local resident by that process, or is it the state who is directly saying, this service is no longer available to local governments? And what do you do when those actors conflict? And there's not, at least put in this framework, and we haven't actually worked all the way through the process yet, is how do managers react to that kind of conflicting legal authority over which elected officials have complete authority over local administrators, but through this process, so do state officials by passing state laws that, particularly in the punitive sense, local officials have to follow. And how do you actually implement policy under that regime? This whole thing is part of a much broader book project, and that's a kind of an issue that we've said is really important, but kind of pushed off fully theorizing about to the book.
You're muted, Dr. Stokan.
Oh, thank you. I think I double-clicked it. So thank you, Quinlan, for the question. Any other questions for Dr. Goodman? I just had one observation, which was when you showed the visualization of local responses. Of course, it's interesting that most of them are centered around mid-March, as you'd expect. But one of the fascinating things is there's some sort of extreme outliers on both ends. And I was thinking, should we be looking to these different local governments as to what to do or not to do? Like, who was the first, response, and who was last in all this?
Yeah. So we definitely, in the data, the very first observation that we have is Washington, D.C. In the end of January. And kind of slowly trickle through February, and then we see most of things ramp up in the beginning of March. The interesting observation, it's a little hard to see from the visualization, is in a lot of states, the local governments were leading the response in the kind of fashion that we would expect under this bottom-up, kind of emergency management regime that I explained briefly. And once the state decided to step in through, and we pick these two broad orders, closing schools and shelter-in-place orders, because they're kind of uniformly applied across states in the sense that they're roughly similar to each other. Many states did other things that are very state-specific that are harder to classify. But once these things, particularly the shelter-in-place orders, were put into place, cities stopped passing ordinances because the state essentially signaled, we're going to do this from now on. We've issued this big, sweeping change, whether it included a preemption or not, and we saw significantly fewer local implementations of policy after that. Because the state decided it was going to be in charge. It solved the border issue by doing it themselves.
Yeah, that certainly makes sense. Any additional questions?
I have another one if nobody else has anything. I'm curious. I'm very curious, sort of about like the business owners, and this might be maybe a little more micro, than what we're discussing today. But business owners have to look at like the economic consequences to them, in regards to business closures ordered by the state versus a reduction in business caused by the very presence of the virus itself. And I think that's a really hard determination to make if you're just operating a business. Are you being affected because are you suffering because the state has ordered people to stay home, or is it because the consumer has less available money to spend, or is it the virus itself is causing people to not want to go out and participate in any kind of economic activity? And I think that makes the constituent response of people saying we're angry about the economic consequences of this, it puts leaders in a very tricky position, because they have to justify their orders and also make people aware that, well, I mean, this thing is real, and it's not necessarily just what I'm doing that's making your business suffer.
Yeah, and that was kind of what I was trying to get at, explaining what was going on in Illinois. We're a geographically large state that is very disparate in terms of its development, and very disparate in terms of the timing in which COVID-19 was kind of particularly influential in different parts of the state. Chicago, being kind of a world city, was very hard hit at the very beginning. Our governor decided to kind of impose a statewide restriction on a lot of things, and the communities in the southern half of the state essentially saying, we don't see any cases of this at all. Like, why are you restricting our ability to do all kinds of things because of this? And the standard response, and one that I think is completely prudent, is this thing doesn't respect any boundaries. People move around the state freely. This is eventually going to become a problem, and if we don't keep it in check right now, it's going to run out of control very quickly. And that was kind of the standard response for many of these kind of floor preemptions, was we need to do a blanket issue or blanket order here to protect everyone, and we understand that's going to cause a lot of economic pain, but if we don't, it's going to be exponentially worse because of it. And we have in this state issues with state border communities, because many of the states around us are not nearly as restrictive. So the state breaks the geography of the state up into various regions for public health purposes. And the region that's right outside of St. Louis, it's Region 4, right up against both Iowa and Missouri, who have significantly fewer restrictions on all kinds of things right now. And that particular region has seen kind of rampant growth in new cases and all kinds of things, because there's this cross-border issue of, there are restrictions in Illinois, but there are basically no restrictions in Missouri or Iowa. So folks go to Missouri and Iowa to go to a bar or wherever that may not be allowed in Illinois. And that cross-border issue has led to, issues in Region 4, that even though the state then imposed kind of higher restrictions, they went backward on our opening scale, I guess is the technical term for it. It still took almost 3 weeks to get things reasonably under control, because that border is very porous. And that was also the region that was their state legislators were yelling the loudest about being restricted at the beginning of this, and suing the state and all kinds of other things, saying, this doesn't affect us. So it's very difficult. It's a very difficult thing to tell, the business community, like, we have to do this from this perspective, particularly at the beginning of this, when we didn't really know what was going on. Like, we have to do everything we can to stop this right now. And once we figure out, better ways to open, mask orders and things like that, we will do that. But not doing it means we're going to have exponentially more economic pain than we already experienced, which was pretty bad. So some of this was just reactionary policymaking, and that's understandable. Like, this is not a typical emergency. Our system is not designed to deal with this in a way that requires this level of coordination. And we've been slowly figuring it out over time as to how to effectively do this. And we've certainly got better at it. Clearly not good enough yet, but we're getting there.
Great, and good question again. Any additional ones? I'm certainly interested. Obviously, you're a public finance scholar as well, right?
Yep.
And I certainly know some of the work there. What do you think long run? What's maybe short and long run, given this underlying tension in the economy and what that means for administrators and public finance?
Yeah, that's gonna. The more recent evidence is very disparate in that states that relied less or rely less on sales tax are less hit. That it seemed like the income tax is far more stable in this than we thought it was going to be. That a lot of the kind of early declines in sales tax or income tax revenue were really associated with the federal government pushing back the deadline for filing income taxes, which most states piggyback off of. So that revenue was just delayed, not gone. But the sales tax revenue from March and April, particularly, a lot of that consumption, a sizable chunk of it shifted. So people who were going to buy cars that didn't buy cars, things like that, shifted into the future. But all of that kind of normal consumption went away probably forever. So just in our look here of looking through kind of the industry by industry sales tax data, we saw kind of increases in normal things that you would associate with having to be at home all the time. So groceries and home goods and things like that. But a lot of the entertainment and all of the stuff that happens outside of your house went down in a huge way. And that's stuff that's unlikely to be pushed into the future. It's just gone. So for localities and states that rely heavily on the sales tax and rely heavily on kind of entertainment related sales tax stuff, there's going to be a lot of pain because that's not stuff that's coming back. And that's really where people like myself and others are pushing the federal government to do something, and that there is a sizable chunk of revenue for a lot of state and local governments that's just gone, and that doesn't connect with the services that we need to continue to provide, public health and all that kind of stuff. And state and local governments face a strict balanced budget requirement. They have to, if revenues are down, we're going to have to cut spending to equal that revenue. Like, that's pretty much the only option. So there's definitely it's looking better than it was, but it's still not good by any stretch.
Yeah, that makes sense. I mean, even thinking about the underlying motivations and the differences in terms of revenues from a state and local government, where states, right, have, sources such as sales tax or income tax, how that differentially impacts them versus, say, the property tax at the local level.
Right.
How resilient that might be, particularly as some of these economic policies that have helped to stabilize go away, what that will look like longer run.
Yeah. Well, and it an issue that we're seeing, and how generalizable this is, we're not quite sure yet, is the incentives on part of states to open more quickly, who are more heavily reliant on the sales tax, and that they need these these businesses to be open and fully open and selling to the public and people buying stuff to balance their budgets. So there's an incentive, there's this inherent tension in that the public health side of things says we need to go at this fairly slow and monitor the condition and open slowly, with the other side of it saying we need to open as quickly as possible because we need all the sales tax revenue that we can generate. And really the federal government could stop that by just providing aid to state and local governments. The federal government doesn't have the same kind of restrictions as state and local governments. So we could get rid of that revenue raising incentive, tomorrow, if the House and Senate got together and actually passed some kind of legislation associated with this, which would probably slow down a lot of the openings, which would probably be good for kind of the public health outcomes. Yeah, so it's all connected in some way.
Absolutely. Well, good. Is there one more burning question for Dr. Goodman before we're at time? All right. Well, I want to thank you very much, both on behalf of the Department of Political Science at UMBC and UMBC generally. Very glad to have had you here, and thank you for taking the time to share some of this really cutting edge research. I mean, this should hit print, well, the way these things go, right? 2021
Yeah, who knows?
at some point. So I certainly look forward to the article, and thank you very much for your time.
Yeah, thank you very much for having me.
I'm very glad to. All right, well, take care.
Yeah, thanks everyone.
And for those of you who are in the class, again, today is one of those days that we're going to meet in the full group session. If you haven't yet already identified a time for the one-on-one sessions, please make sure to do that. So I sent you an individual email if you haven't yet selected a time, but we will meet today as part of the normal class. So, but let me just open it up right now. Were there any particular questions? Yes, Alex, there's two sessions that you need to sign up for. One is at the beginning of the semester and one is later. So, and I can, when we meet today, we can go through that as well. So, but any thoughts from the talk today?
I think it's very interesting how he's kind of contextualizing the preemptive events during COVID with the earlier cases of this. And I'm thinking about this like in Massachusetts. I don't know what the exact rules are, but there's a lot more restrictions on liquor stores when